Welcome to Ask a Latina. Last year I had an accident falling off a ladder while working on my Christmas lights. The tibia bone under my knee was shattered. It was a blessing that I had found an orthopedic surgeon who was able to save my leg. But while I was undergoing 3 surgeries and during my hospital stay for 3 weeks, I never saw a Hispanic doctor. Given the growing population of Hispanics in the United States, there are roughly 3,000 Latino patients to 1 Hispanic physician. In comparison, for non-Hispanic physicians, there's a ratio of 300 patients to 1 doctor. So according to the Association of American Medical College of Hispanic Students, they only make up 6.4% of all medical students. So our guest today is Dr. Maricela Castillo Mackenzie to share with us her journey and her passion to see more Latinos and Latinas enter the field of medicine. Thank you, Doctor, for being our guest today, and we're in a very important topic as well.
Thank you so much, Terry, for having me.
I appreciate that. Can you please tell us about your childhood and when did you become interested in medicine?
Sure. So I was born and raised in Mexico. I was born in Mexico City and then raised in Mexico City and also in a suburb outside of Mexico City. I am the oldest of 3.
Oh, wow.
So during childhood, I was always, I always liked to study. So I always liked books, and I always liked to get good grades, and I really liked school. It wasn't until I was, I think, in junior high that I was really interested in medicine. And once I started high school, I really confirmed that I wanted to get into medical school. And as part of, one of the subjects that I had to take during high school, I had to do a full research of what medicine was and to make sure that I really wanted to get into medicine. And I had to shadow physicians, and I had to do interviews, and I had to go to clinics, where I could actually find out and see what it was, to be a doctor, and if it was something that I really wanted to do or not.
Great. So where did you get your education?
So I did medical school in Mexico City, and then residency in family medicine. I did it at Henry Ford Hospital here in Detroit.
But you were in Mexico City at UNAM, right? Which is
so
very popular.
I started my medical school at UNAM, and I did 1 year at UNAM, and then unfortunately went into a strike. So after the strike, I joined another university called West Hill University, which is affiliated to UNAM. So I was still having professors and teachers that were UNAM professors and teachers. So I was able to get my diploma from UNAM and from West Hill University too.
Oh, okay. And then you came here.
And then I came to the States,
Oh, great. What was the most challenging that you had while you were studying medicine, and how did you overcome it?
So I think probably it was the strike, because first of all, I was in a private school during high school, and I had to compete to get into medical school. So in Mexico, after high school, you go straight into medical school. But because UNAM is a public university, you compete amongst everybody in the country, and sometimes people from outside of the country too.
Right, and the cost for UNAM.
Oh, it's very cheap.
Very. So
very
that's
cheap.
why it's so competitive.
It is very
And they
competitive.
pick the best, and they do.
Exactly.
Yeah, it's a very prestigious.
Exactly. So it's very competitive. So you have to get a very good mark in order to get into medical school. And medical school is probably one of the most competitive because it's one of the best ones in the country. So I remember that when the first time I tried to get into medical school, I was shy 5 points from getting into medical school. So it was pretty hard on me, because I was devastated. I studied very hard for the test, and at that point I was like, well, what am I going to do? But talking to my parents and thinking about like, okay, this is what I really want to do. This is my goal. So it didn't matter. I went back to study even more, and got more books, and then I got myself better prepared for the second test, because they do 2 tests per year. So during the second test, I did way better, and I was able to get into UNAM.
That's
medical
good.
school.
Good for you for not giving up, especially
Right.
with a little teeny bit that you had to go.
Right,
That's
right.
wonderful. How did you decide to, well, first of all, what did you specialize in? How did you make that decision?
So I'm a family physician, and I think during medical school you go through different rotations,
Okay.
and I kind of really like every single rotation. So I was doing my rotation in ophthalmology. I like ophthalmology. I did dermatology. I like dermatology. So that's how I decided to become a family doctor, because I like everything in medicine, not just one specialty. And also I like to talk to my patients a lot, and I like to take care of the whole family, not just an adult or just a kid, but I like to take care of everybody.
Wow, that's great. So that's how you decided to specialize in that area then?
Correct.
Okay. And then are there different areas as well that a doctor can specialize in other than family?
Oh yeah, there's several ones. There's pediatrics, family medicine, internal medicine, anesthesiology, surgery, ophthalmology. So every single organ in your body basically has a specialty.
Right, right. So do you see many Hispanic doctors, especially Latinas?
No, unfortunately, we're very, very few doctors, as you mentioned, especially here in Michigan. Hispanic physicians, we are less than 3%
Wow,
of
that's
the
very
total
small.
of the physicians.
Yeah, well, I understand that the biggest hurdle for recruiting Hispanics into a medical field is financing because of the pricey education here in the United States, especially. And the average debt for a medical student in 2009 was $156,456, according to Association of American Medical Colleges. And the Latinos, more than any other group, finance their bulk of their education with loans as opposed to financial aid, scholarships, work study programs, family contributions, and other resources. Anecdotal evidence suggests that this is simply because Latinos don't tend to have the same financial support from family or knowledge of available resources as their higher income counterparts. How did you overcome any financial college? I know in Mexico it's different, but when you came here, if you're continuing, what would you recommend our Latino viewers if they're interested in going into medicine and this is a factor?
Right. So actually, when UNAM went into strike, I had to apply to a different university. So I went to West Hill University, and that was a private university. So because of my grades, I was able to get 50% scholarship. So that really helped my parents and myself. So obviously, the cost of the university or college in Mexico doesn't compare to the cost of the university or college here in the States. But still, it was substantial. I need, it helped, and also, I was able to go into, medical school.
Yeah.
So I think one of the main things is to keep good grades, during high school, because those grades are going to help you to get into college, and then during college to get good grades also, because those are going to open the doors to get scholarships. Scholarships, there are a lot of scholarships available, especially for Hispanic students. It's just a matter of knowing where to find these scholarships. But there are scholarships available, especially if you want to get into medical school or any of the health sciences.
Okay.
So I think that's a very important thing to do. To start getting good grades since you are. If you can, junior high, high school, college, just because that's going to open doors for scholarships, so you don't have the financial burden, and you can go into medical school.
That's good, yeah. And what necessary primary education in high school exists that Latinas should consider as far as going into medical school?
So, during high school, it's important to get into science, different subjects are important, like physics, biology, anatomy. Those are going to be very important because
kind of the STEM programs.
Exactly, the STEM programs, and because in order to get into medical school, you have to have 4-year undergraduate, so a 4-year bachelor degree, and then you apply for the MCAT to get into medical school. Now it's important to get, you can actually study whatever you want during those 4 years of bachelor, of getting your bachelor degree, but it's important to get these topics or these subjects like any of the biology, anatomy, physics, chemistry, those are going to be very important for you to get into medical school. And of course the MCAT, which is a test that gets you into medical school, is very heavy in those topics.
Wow.
So it's important to prepare yourself from high school with those subjects.
That's good. That's a good recommendation. Pew Research indicates that when emotionally distressed, as Latinos, we tend to rely on our native language. I know that's, I've seen that with my own family.
Yeah.
So it is extremely difficult to find bilingual or bicultural medical specialists. And so how much of a value is having a doctor be bilingual, biculturally relevant to a Latino family in your view?
It's extremely important. Because not only you talk to your patient in the same language, you know the culture, you know the traditions, and because of that, your patient is going to trust you as a physician, and your patient is going to trust if you taking care of himself or herself, and also in my case, of their family, which is very important in the Latin community. Families are the base of our community, and it's a very important part of our culture. So knowing that your doctor speaks the language, they will understand perfectly what you're talking about, and they will understand perfectly whenever you have a pain or simple words that probably not just being bilingual you might understand, but also making culturally appropriate, decisions. Like, for example, and this is something that I teach, my residents or medical students. Like if we have a Latin patient, you can't just say you can't eat corn or you can't eat tortillas anymore. I mean, those are important aspects of
your family, their life.
The family, the
culture.
nutrition, the culture. So you have to be a little bit more cultural sensitive about that, and you can't just say you need to stop eating tortillas, because that's not going to happen. Or you have to stop eating rice. That's not going to happen. But
potatoes.
instead, exactly, but instead it's like, you have to cut down on this, you have to cut down on that, because otherwise, if you don't have the cultural aspect, in terms of your recommendations and, your diagnosis and things like that, your patient is going to get lost, and they are not going to trust you, and it's going to be hard to follow your recommendations.
Right. Now you mentioned that you talk to other physicians. So as a Latino doctor, do you think there's a difference in your own patient relationship with a Latino patient than with a non-Hispanic patient when you're speaking to them?
Correct. Yeah, definitely. The moment that I see a Hispanic patient or a Latino patient, the moment they see that I speak Spanish, they just have like a huge smile, from ear to ear. They are relieved, and then the moment they know that I'm, for example, Mexican, and they're Mexican too, that's more, that even helps more, just to, and it is very helpful, because like I said, it's that piece of trusting your physician, and for diagnosis and recommendations and things like that.
Right. I know when my mother was in the hospital, and we had a Latino doctor from Panama. And immediately I saw the connectivity, although she was a registered nurse, retired, the connectivity was immediately, the doctor had this respect, señora, and all this stuff, really explaining. Where I saw the doctors, the other ones that came in, it wasn't the same. Right. And I felt more comfortable with him, even though I was, I'm first generation born here, I still felt more comfortable because I saw the respect that he showed and the connectivity that we had. So it made a huge difference.
Right, and that's also part of the bedside manner, It's the bedside manner. It's also different, just because of the culture, and we know the culture very well. And me as a Hispanic physician, I know the culture very well. So it does help, with the patients, and to get where we want to get, basically.
Right. Yeah, exactly. So then another obstacle facing aspiring Hispanic doctors is the lack of support from the community, and sometimes even from our own family. So if you've never seen someone in your community, like they probably might have not seen a family member or a friend of a parent or the next door neighbor become a doctor, then their aspiration or dream of becoming a doctor is not really going to happen. So you're highly involved with the community, and I understand that you've been dedicated to getting more Latinos and Latinas in the medical field. Tell us about that, and how are you out there now, because you're kind of like that model for the
Correct.
Latinas and Latinos.
And that's right. I mean, there's been a lot of studies showing that, if kids or teenagers don't see role models or of what they will like to be or what they're aspiring to be, it's going to be very difficult for them to become that.
Exactly.
So I've been very involved with the community, as you mentioned. I try to go to high schools, especially in Detroit, every year and talk about medicine and talk about like the steps that they have to follow if they want to get into medical school. And also, I've been very involved in the teaching part. I currently work at the University of Michigan, and I work with medical students, and also I'm the lead of a program that we have that is called Spanish Language and Community Medicine track for the Family Medicine Residency Program, where we are looking, or we're seeking for Hispanic or Latino physicians that want to take care of our Hispanic patients within the University of Michigan in the Family Medicine department. And that's because of, we know that Hispanic physician is going to, be very helpful with the community, and they are also going to be big role models for the kids and for anybody who might want to get into medicine. Because like you mentioned, we are very, very few Hispanic physicians, not just in Michigan, but in the whole country. So it's important for each one of us, the few physicians that are already practicing, to help the pipeline and start helping from little ones, junior high, high school, college, all the way until residency.
That's great, wonderful. So some of the other things that Hispanic families should understand, you might want to be able to help with that, is that I understand that sometimes they have a son or daughter who's interested in studying medication. There are some obstacles there too, where they're worried about not just the financial, but the time it takes, right?
Right, yeah. Unfortunately, it's a very demanding career. You have to make a lot of sacrifices and time. You have to study a lot. You might have to say no a lot of times, like to family events, to parties, to going out, to going to the movies and things like that. But if it's something that you're really passionate about and you really like it, it's not gonna feel as heavy or as bad. It's something that you're really going to enjoy, and at the end of the road, you're going to see how much you've done, and you're going to be feeling very happy about what you've done. So it's definitely not an easy path. It's there's a lot of obstacles, and but like I said, if it's something that you really want to do and you're really passionate about, you're going to overcome any obstacle in your way, and you're going to become a physician.
Right. I know a family from Peru, and their son is going to be in the medicine. He's actually looking into a specialty, and he knows it's going to take 12 years already.
Correct. Yeah.
And they're prepared for that already.
Exactly. So depending on the specialty, so you need to do 4 years of undergrad, then you take the MCAT, and then you have to do 4 years of medical school, and then after that, depending on the specialties go from 3 years up to 7-8 years. So you are studying, about like 14.
So it's a good thing to start early.
Correct. It's important, but like I said, I mean, it's just if you follow your passion, it's not gonna feel like it's a long time.
No, I think it's great.
You're just like what you do, and you keep going.
It's a wonderful career. We want to see more Latinos and Latinas in there.
Correct.
So thank you, Dr. Castillo Mackenzie. I really appreciate you being here, being our guest today, and I know you've inspired a lot of Latinas and Latinos watching our show and considering this career in medicine and how important that is. So thank you very much.
Thank you so much for having me. And to anybody out there, don't give up. There's opportunities out there. You just have to follow, your passion and your heart.
That's right. So this concludes our show for today. And if you'd like more information on medical and career and colleges of the United States that we have here and which ones to visit, feel free to check our website out, and we'll be glad to post all the information in there, especially things that we've talked about here. So thank you, and we look forward to seeing you again in another episode of Ask the Latina.